Thank you for choosing Tampa General Hospital for your upcoming surgery. We know this can be a stressful and confusing time for you. There are just so many details to keep track of. This video will guide you through the entire process so you will know where to go and what to expect when you arrive at the hospital. More than 26,000 surgeries are performed each year at Tampa General, but we understand that right now your surgery is the only one that matters to you and your family. And for the time you are with us, your surgery will be the most important one we do. The clinical staff you will meet is highly trained and dedicated to making your surgery at Tampa General Hospital a very good experience. They will look out for your well-being every step of the way and keep your family informed of your progress. Your clinical team will include surgeons, specialty physicians, nurses, medical technologists, and other support staff. The final member of your team is the most important one of all, and that is you. As the patient, it's important that you play an active role in this process. Please speak up and ask questions about your care. Tell us what we can do to make your stay with us better. By the time of your scheduled surgery, we want you to have answers to all of your questions. Now let's take a look at what you can expect before, during, and after your surgery. Depending on the kind of surgery you are having, you may need to come to the hospital before your procedure for what we call a pre-op visit. During this visit, you'll receive instructions that you will need to follow before surgery. These instructions are designed for your safety and to provide the best possible outcome for your procedure. Failing to follow these instructions could result in your surgery being canceled and rescheduled. During this visit, you will also meet with your anesthesia provider who will answer any questions you may have. The best part about your pre-op visit is that you can eat and drink as usual on the day of your pre-op appointment. Fasting is not necessary. Some kinds of surgery do not require a pre-op visit. In those cases, a nurse will contact you by telephone a day or two before your procedure to obtain your health and medication history and provide you with instructions. If you do require a pre-op visit, it will be scheduled by your surgeon's office. When you arrive at the hospital for this appointment, your first stop will be at the admissions desk located just inside the main entrance. The admitting staff will help you register as our patient and issue your identification bracelet. They will also give you a folder of very useful patient information. Please read this material carefully and keep it with you during your visit. If there is something you do not understand during the registration process, please speak up and let the admitting staff know. When you finish registering, you will go to the pre-op center and a nurse will meet with you to obtain your health history and review your current medications. Be sure to bring all of your medications to this appointment, including any over-the-counter medication, herbal supplements, or vitamins that you may be taking. It is best to bring them in their original containers. Let the nurse know if your surgeon provided you with any additional instructions prior to your pre-op visit. Be sure to read your instructions and ask questions if something is not clear. Some medications, such as blood thinners, need to be stopped before your surgery. Be sure to check with your surgeon regarding any medications that need to be stopped. You will also meet with an anesthesia provider to review your anesthesia needs for your surgery. Most patients receive what is called general anesthesia, which temporarily puts you in a deep sleep and prevents you from feeling pain during surgery. It is during this visit that any additional tests like blood work, EKGs, or X-rays will be completed. You may also meet with other healthcare providers involved in your care. If you have prepared any advance directives such as a living will or healthcare power of attorney, please bring them to your pre-op appointment. Our staff can assist you with these forms if needed. Your pre-op appointment could take a few hours depending upon what test your physician has ordered, so you may want to bring a book with you. And here are some additional things to remember for a successful pre-op visit. Bring all current medications to this appointment, preferably in the original containers. Bring a list of questions you may have. There are no silly questions, so please ask. Bring any forms, orders, or consent forms you may have received from your doctor. Bring any advance directives you may have. If you have questions before your surgery, you can call your surgeon's office or Tampa General Hospital's pre-op center at 813-844-7869.